they both are in response to inhaling irritating substances. The irritating substance in vocal cord dysfunction is, what can tip you off is that often the irritant is a pleasant odor, something that most people would enjoy smelling, like scented candles. Or people with laryngeal dysfunction have a hard time going to a shopping mall when they pass by the bath and beauty shop. They have to stay away from there. Or if you go in a department store, you have to give wide clearance to the purchasing counter because you just can't stand the odors like that. And if you have those symptoms, you should suspect that part of the problem, at least, is coming from the larynx. It's very common, and it has a little different approach to treatment, particularly because of the influence of gastroesophageal reflux on the larynx. The larynx sits right in front of the top of the esophagus. And down the stomach, you have an acid factory, and it's very common for little bits or even large amounts of stuff to back up the stomach and hit the back of the larynx. And that makes it irritable, and when it gets irritable, it responds to all kinds of irritants in the air that you breathe in, including things that you wouldn't even regard as irritants usually, like a smell of perfume. And so gastroesophageal reflux becomes very important in the management of obstructive lung disease, particularly if there's a component of laryngeal dysfunction. And that's why it's important to take some time to talk with people and find out in detail what are the symptoms like and when do they feel worse. You can pick up these triggers, and sometimes they'll point you in a certain direction.
Is this laryngeal thing separate from the emphysema? Because I have
Yes.
a lot of problems talking and I have my voice.
There's another clue to laryngeal dysfunction. The typical person with vocal cord dysfunction would have sensitivity to odors, including pleasant odors, would have a history of some gastroesophageal reflux, would have voice symptoms, which is hoarseness that comes and goes, clearing the throat a lot. Some people are constantly trying to get a feeling of mucus or congestion out of the throat. Vocal fatigue, which is if you talk a lot, you tend to lose your voice. In addition to episodes of shortness of breath and wheeziness. And if you pay close attention to exactly where the problem is, you can often feel that the problem is up here in the throat, where it feels like your throat's closing up and it's getting hard to breathe. People who have laryngeal dysfunction often have a peculiar symptom of waking up at night smothering, which you don't see in other respiratory diseases. A lot of people will wake up at night feeling out of breath, or wake up at night coughing. But if you have this particular symptom, which is waking up at night feeling with smothering, you wake up startled, you can't breathe, you feel like you're going to suffocate, like this is it, I'm dying, you can't get any air at all. You try to call for help, and your voice doesn't work, you can't speak either. Now, this only lasts for about 15 seconds. But at the time you wake up with it, you don't know how long it's going to last. So you really get scared. And after it happens over and over and over again, if you have this symptom gets to recur, then you get used to it and you know that it's going to pass. And so it's not so startling. But the first time it happens, you really think your number is up. And that comes from laryngospasm. Your larynx is reacting usually to reflux that came up from your stomach. Starts down into your larynx, and your larynx says, nope, not going in there, because it tries not to let any of that stuff from your stomach get down into your lungs where it can cause pneumonia. And it closes up. And once it closes up, it stays closed for about 10 or 15 seconds before it opens again. So you wake up with that terrorized feeling like you're just not getting any air. And that is a symptom which is often overlooked by doctors who are taking history. Doctors frequently say, well, you had a problem breathing overnight. And that can be heart failure, it can be bronchitis, it can be asthma, it can be a lot of things. But that particular symptom, where you wake up scared to death and you can't breathe and you can't talk, is something different. And it almost always goes with laryngospasm that's brought on by reflux, stuff coming back up the stomach that is triggered at the lungs.
I'm going to go back a little bit to the allergens, if possible. I wonder how effective these saline rinses are, like Neomed. Using them on a regular basis, how they help people with sinus and asthma and COPD, well, probably not so much COPD, but definitely asthma, with allergies.
Yeah, saline irrigation is usually very helpful. Most people who have chronic sinus problems find that they feel a lot better if they use the saline irrigation. And it's a kind of a strange feeling the first couple of times you use it, because when you think about it, you think that it's going to feel like when you went to the beach and got salt water on your nose, which is not at all what this feels like, but that's what you'd imagine if you've never done it. If you're unfamiliar with the whole operation, you get a squeeze bottle that holds about 10 or 12 ounces, and in it is water which has a little salt solution added to it and some buffers to make it less irritating. And you squeeze it into there's the neti pot where you can pour it in your nose, looks like a little teapot, or a squeeze bottle where you lean over the sink and squeeze it in one side of your nose, and it runs in one side and it runs out the other side, down into the drain. And you wash out anything that is in the nasal passages and sometimes something in the sinuses as well. So you can wash out mucus and wash out allergens, bacteria, anything else that you've inhaled with the dust that's in the air that you breathe. So it's a very good way to wash out. Now, most people who have chronic sinus disease and nasal stuffiness, after you do this a few times, you start to feel like, that's pretty good. I feel much better after I do it. You generally only have to do it once a day. Some people do it twice. There are some people who never do like this and they try to do it just can't do it.
Just want your advice on whether or not it should be done in the morning or in the evening. Which one have you found to be the more effective?
I would say, try it both ways and stick with whichever way you like. Whatever fits into your daily schedule and what seems to work better for you.
Are you recommending distilled water now over the tap water due to some incidents?
There are rare cases of people getting sick from germs that are in tap water from doing this. So the water that you use ought to be distilled or you can boil it.
I did it for a couple of years for the doctor here in town, and also because I had severe nasal polyps, so I've had 2 surgeries, major surgeries, but it's under control now, and that was of course my asthma. But it was a hard thing to get used to at first, but then it became so routine because it felt so clean, and then you also add the medication to that.
That's another thing too. If you have sinus infection, you can introduce anti-inflammatory agents like budesonide. You can introduce antibiotics this way, and so ENT doctors know when to prescribe those things to add to the nasal irrigation. But about the infection, yeah, I do recommend either use distilled water or take the biggest pot you have and boil water. And then that water is okay. And you can put it in a clean container and use that water until it's time to boil another batch.
What treatment do you recommend for the dysfunctional larynx?
Okay, mostly it's very intense treatment aimed at acid reflux. If you can stop the refluxing, usually the larynx will recover. It takes a few weeks, but that's usually the most effective technique. You usually, since everything is inside, the stomach, the esophagus, the larynx, it can happen without you realizing it's happening, especially if you are sleeping about this. If something damaging is inhaled from the outside, you're going to be awake and be aware of it. And so you can put 2 and 2 together pretty easily if you're inhaling smoke or something from the environment. But things that happen when you're asleep and if it's all within your body, you wake up and you just know how you feel, you don't know what did that. Acid reflux is so common that most adults have some. And only half the people who have acid reflux have heartburn. The other half have symptoms that are further up in the throat. So it may be very mild, like having a little bit of a froggy voice in the morning and have to clear your throat some. Or it could be a lot of irritation in the larynx that leads to difficulty breathing, wheezing. People with the worst cough I ever see are people with what's called laryngopharyngeal reflux, which is damage to the larynx from acid coming up from the stomach. And the way that you get the cough to stop, and the way that you deal with the other problems coming from the larynx, is to first of all, take the acid out of what's in the stomach by giving acid suppressant medications, but frequently also change the diet, change the sleeping position so your head of the bed is elevated and you're sleeping more upright position.